to PA 400-500C, Public Policy for Health, Security, and Resilience. My name is Nathan Myers, and we're going to be continuing our discussion of the reading material from week 4, focusing on communication. In this presentation, we're going to be looking at the material from Katz and Moore, Chapter 7 from the Outbreak Atlas, which focuses on communicating with the public. So again, I'm going to try to hit kind of what I think are the more salient points in the chapter. So it talks about establishing resource centers. Some core tenets of the resources that would be provided in these resource centers are that they need to be accessible, easy to use, well advertised, and clearly communicate essential information. Resource centers are most effective when there are clearly established goals about their use and their target audience is defined. Potential goals of resource, before we get into that, so some examples of resource centers would be in regard to avian influenza, with some of the resources that I provided in the modules and some of the things we've talked about online. You know, they provide some resource centers for avian influenza for veterinarians, things that veterinarians should know about the current outbreak in terms of symptoms and the current distribution throughout the country and things like that, animals that have been affected, and then also resource centers for farm workers and groups like that. So focusing, information, I mean, you can have general information, obviously, that's accessible to the public at large, and we've looked at those previously, but also having sort of targeted information for these particular at-risk groups. So you can have, resource centers for, people who are elderly, or people who work with children, individuals like that as well. Things that those people in particular should be aware of, in addition to all of the kind of general information about avian influenza that we should all be cognizant of. So it says potential goals of resource centers include providing accurate public health information and risk communication, which includes information about infection prevention and control. So providing good information about how to control the spread of the virus and help to protect yourself and to protect your loved ones or coworkers from the virus. So if it's a situation where wearing masks would be useful, providing that information. If it's a situation where you need to be especially cognizant about cleaning surfaces, providing that kind of information. Allowing community members to report rumored or suspected cases of a disease. So there again, providing contact information for local public health authorities, state public health agencies, the federal authorities. So, if veterinarians encounter livestock or wild fowl that they think is infected, giving them some place to go and report that information, as well as doctors and members of the general public as well. And the final point there, identifying trends in public requests or misinformation about an outbreak. So if there are particular rumors or particular, conspiracy theories or what have you going around, identifying those and trying to provide correct information, trying to provide people with reliable, scientifically valid information to counteract any disinformation or misinformation they may be encountering. So obviously these resource centers would need to be staffed. You can certainly, you can put this material on the internet and places, publish it on social media. But you also want to have resource centers where people can actually go and talk to people, as some people are going to find that more credible and more convincing than just reading off of a website. So, again, you can publish websites designated to particular outbreaks, and certainly there was a lot of that during COVID-19. There were a lot of resource centers you could go to from the CDC and from Johns Hopkins University and other sites to find out information, providing new pages to the primary website, having hotlines. Those hotlines can have personnel attached to them, as we were just talking about, or they could be automated or some combination of the two. So again, for people who have just sort of basic questions, automation might be the way to go. But if people have more kind of in-depth kind of questions that aren't necessarily entirely cut and dry, you want to have some place for them to go as well. So hotline and call center staffing may be employees, volunteers, or some mix of the two. Depending on the resources available and the extent of an outbreak, these could be 24 hours a day, or they could have defined hours. And you may have it set where people can call in and get an actual person to talk to during certain hours of the day. And then if they call after hours, they can get an automated response. So Katzenmoor notes that it's important that reporting and feedback mechanisms exist between the information resources and the decision makers and outbreak responders, so that they can coordinate, evaluate, and adapt their response based on the information that's reported. So if people are providing, new information about increased instances of wildlife infections, or infections among cattle, or infections among chickens and turkeys and things like that, you want to stay on top of, emerging spread. The virus may be mutating, maybe spreading at an increased rate. Certainly, if it's seems to be spreading more easily from person to person, or if you're seeing more human infections, you definitely want to stay on top of that and be able to react to that very quickly. The reading notes that there should be an established routine for updating resource and hotline information when new epidemiological information is obtained. For example, when new epidemiological evidence leads public health officials to update prevention measures. So again, during COVID-19, there was some confusion at the beginning, because initially federal authorities were saying people don't need to wear masks. In fact, some people said they shouldn't wear masks at the beginning. And then they realized that there was more airborne transmission going on than initially believed. And then in fact, it wasn't transmitted through particulates. So then they updated the prevention measures and said, okay, people should wear masks in enclosed spaces, particularly if they're working, in relatively close quarters with people. So, as things evolve, the message needs to evolve with the best information available. So in terms of crafting the messages that go out to the public, and the last example that I was just talking about in regard to, wearing masks, not wearing masks, that's actually kind of a good example, because, they were, when they said at the beginning, don't wear masks, they were working off of the best information at the time. But the way that it was communicated, really, made people feel like, that, masks really weren't necessary. So then when the government turned around and said masks were going to be necessary for indoor spaces, some people were very resistant to changing their behavior. So you want to make sure, one of the things you want to make sure with public health messages is you acknowledge the fact that you're working with the best information that you have at the time, and you want to always leave it open that this advice, these recommendations could change as the information changes, as the data changes. So public health messages should include basic information about the outbreak, the type of disease, how it spreads, the symptoms, basic data as far as how many cases, hospitalizations, and deaths there have been, who is at most risk and why, and what can be done to prevent exposure and stop the spread of the disease. So it goes on to say messages should be clear and concise in a simple language so you can engage effectively with the required populations, particularly those who are likely to be affected most directly. And you don't want to under or over reassure the targeted audience. So there again, one of the things you want to avoid, especially at the beginning, is creating so much of a sense of security and so much of a sense of assurance that you're taking away any sense of risk involved. So people during the early stages of the COVID-19 pandemic talking about how this wasn't likely to affect the United States, that if it did affect the United States, the effect would be minimal and things like that. You want to be careful about communicating that kind of risk because again, similar to the situation with masking, if you have to go back and reverse that later, it's going to make the messaging seem less credible, and it's going to make the people who are delivering those messages seem less credible, and people may not accept those recommendations. So again, with avian influenza, even though there's very limited human transmission going on right now, and you do want to assure the public to some degree that there is limited risk of human infection and severe human illness, at the same time, you don't want to say anything that's going to completely close people's minds to the possibility that it could become a risk in the not so distant future. So in terms of mass text messages being used for emergency communication, it provides an example from the Republic of the Marshall Islands during the summer and autumn of 2022 in response to outbreaks of the RSV virus. Citizens in the Marshall Islands received daily text about how to limit the spread of the illness. RSV, which stands for respiratory syncytial virus, is a common respiratory virus that causes cold-like symptoms but can lead to serious illness and hospitalizations in infants and those with compromised immune systems. So the Department of Health and Human Services for the Marshall Islands sent out the text advising avoiding close contact with sick people, cover your mouth and sneezes, clean and disinfect surfaces, and stay home when you're sick. A lot of which, is reminiscent of obviously what was said during COVID-19, because the primary transmission method is via droplets, similar again to COVID-19. The mass tests also provided guidance for monitoring disease in children and advising adults about when to seek medical attention. So, a few things with this. One is, the idea of sending out mass texts. And a lot of us get mass texts on a regular basis. I get a lot of like news alert kinds of things on my phone. I get, text messages from various, organizations I'm subscribed to, or if you sign a petition or donate money or something like that, you're going to get text messages. A lot of them are asking for money and asking you to do different things. So there is the risk with mass text that they could be ignored because they kind of get lost in the shuffle with all these other messages. But it is a technology that you really can't ignore because it is a quick, efficient way of getting information out to the public. I think, you know, some of the key ideas here, the last point about advising adults about when to seek medical attention, I think this is a really good use of mass texts because, you know, one question that just, you know, regular kind of younger to middle-aged people, you know, they might be feeling symptoms of something, they might be concerned, but they don't want to go to the doctor unnecessarily, or they don't want to go to prompt care unnecessarily. So, you know, providing the guidance about, you know, this is when you should go to the doctor, this is when you're probably okay, just stay home and rest and drink plenty of fluids and all of that kind of recommendation. So I think that's a really good example of a use of mass texts in terms of preemptively answering those sorts of concerns. Obviously, there's been, you know, recent examples where mass texts have unnecessarily alarmed the public. I may have mentioned this previously, but the incident that happened in Hawaii, I think a few years ago now, where there was a mass text that went out about a nuclear missile attack coming towards the islands. And obviously that panicked people for a few minutes until a correction was made. So there's certainly a risk with this technology of if you're sending out the wrong information, it's going to very quickly arouse a lot of panic. So again, you've got to be very careful about whatever data you're putting out there. So turning to another example of communications, looking back at this case study of the 2001 anthrax attacks. And depending on your age, you know, some of you will remember this and some of you may be too young to remember this at this point. But there were a series of envelopes that were mailed out, I think it was October of 2001, so just a month after September 11th, the country was still very much on edge. And these envelopes started being mailed to the National Enquirer, I think NBC News received one, a couple of Senate offices received letters. One elderly person died from anthrax, and she wasn't directly targeted, but she was just kind of indirectly affected by the anthrax spores. Senate offices had to be shut down, postal facilities had to be shut down in order to clean out the anthrax spores because, you know, the thing with anthrax was, you know, it's something that, you know, because it's not something you can just, you know, spray with disinfectant and use bleach and things like that and get rid of it because it is a spore, it is a material substance that you need to be sure to get rid of all of it because if you don't, it can continue to infect people for a long time. So the government obviously had to communicate with the public about this because, you know, these letters were sent out through the mail. People were concerned about getting these letters themselves, or they were concerned about getting mail that had been tainted with anthrax. So the case study talks about the complex nature of the crisis and ineffective communication from public health officials resulted in delays administering the known and effective prevention and treatment for anthrax infection, a prophylactic course of antibiotics. This in itself was complicated by the heightened fear, mistrust, and frustration with the federal government's response by public health officials, clinical providers, and the public, and concerns with individuals hoarding antibiotics. So initially there was a lot of confusion because some people were under the impression that anthrax was a virus. So they were thinking, there were medications that they could take or something like that. So there was just some initial confusion about what exactly anthrax actually is, that needed to be cleared up. But the government, because it's still kind of focused on, obviously still dealing with the aftermath of the attacks in New York and Washington and the crash in Pennsylvania. Looking at the military response, the government had a lot of things going on. Not to excuse it, but they did have their attention shifting all sorts of different places. So they didn't do as good of a job sort of communicating with the public and providing them with the information that they needed to protect themselves and to avoid, unnecessary panic, unnecessary concern, things like that. And at the same time, knowing what symptoms to look for in case they actually were infected with anthrax. So we've been relatively fortunate since the anthrax attacks that there hasn't been a confirmed example of a bioterror attack on US soil since then. Obviously, there's the ongoing controversy about the nature of COVID-19 and where it came from. But as far as actual confirmed bioterror kinds of incidents, this is the only clear example that we have in recent memory. So in terms of what kinds of channels you can use to send out good quality communications, news releases and briefings. Obviously, briefings were used a lot during the COVID-19 pandemic, both at the federal level with federal authorities and President Trump, briefing reporters, until it reached a point where people felt like those briefings were starting to become counterproductive because some of the information coming out was starting to be questioned. And then at the state level in New York Governor Andrew Cuomo gained a lot of attention by doing regular press briefings until his leadership and his decisions about the pandemic started to be questioned. So the messenger is important, and obviously the message is the most important thing. So you want to make sure if you are doing regular briefings to the press that it is about getting out good quality information. That, if you're having briefings just to have briefings, it's probably a bad idea, because at some point some misinformation could escape that way. Radio or television programs, obviously, websites, public address systems, and service announcements, designated websites or web pages, which we've talked about, printed or digital materials such as fact sheets, flyers, brochures, circulars, telephone hotlines, toll-free numbers, telephone communication campaigns, mobile text messaging, and social media. So, obviously those different channels are targeted towards different age groups and different demographics. A lot of us are not inclined to answer phone calls from numbers that we don't recognize at this point. So, trying to do sort of a direct calling campaign is probably not going to work for a lot of us. A lot of us are going to be getting our information from social media, from websites. A lot of people in the sort of middle-aged to younger demographic are using radio and television less, and are listening to podcasts and watching streaming services more. So finding ways to, use podcasts, advertising, and advertising on streaming services is an important thing to consider as well. Newspapers, some people read newspapers on a regular basis, some people don't. But the key is, you want to have all of your bases covered. You want to have information going out through channels that are going to reach older Americans that are more traditional. They read the physical newspaper still, they watch regular network television, and then you want to reach out to the very young who are, focused on, social media, Instagram, listening to podcasts, things of that nature. And keeping up with those trends is important, and also recognizing how to effectively use different types of social media. Look at a type of social media like TikTok, for example. Some people during the COVID-19 pandemic were very effective at using TikTok to get their messages out. And then, some people were less effective at getting those messages out, either because the messages came out sounding corny or didn't come out clearly. So you want to make sure that if you're using, newer types of social media, that you understand how to effectively use that platform to reach your audience. And that kind of gets into another point, which is you've got to recognize what your audience is. So, you need to use language and not just in terms of like English versus Spanish and things like that, but you want to use, terminology that people of particular age groups are going to understand and respond to. Coordinating effectively with mass media is an important part of ensuring accurate dissemination of health information, as they play a key role in shaping the narrative during a public health crisis. So, they talk about, nature abhorring a vacuum. And the idea is there that if the government, if public health authorities aren't providing information to the media, that the media is going to seek that information out elsewhere, and some of that information may be misinformation or disinformation. So the media, if the media sees a story developing and they're not getting information from the official channels, they're going to craft some kind of a narrative. So it's important that the government, that public health authorities, the medical experts recognize this early on and start trying to control the narrative. And this can be very difficult to do, because oftentimes, especially with the public health situation like a new infectious disease, there's a lot of confusion, there's a lot of ambiguity going on. So people don't want to go out there and make a fool of themselves by saying something that's not correct. But at the same time, you've got to at least provide that information that you're aware of, and try to steer the conversation in a more productive direction. So again, different branches of the media that you can work with: news, which we've talked about, advertising, so working with advertising and PR firms. A lot of this was done when they were distributing the vaccines and trying to communicate to the public, maybe that were hesitant or unwilling to take the vaccine, trying to craft advertising messages that were going to convince them to do so. So that would be a good example of that. Entertainment, again, using the entertainment industry, either in advertising campaigns or through television shows, and movies and things like that, trying to send, pro-public health messages, whether it's, pro-vaccine messages or messages about, staying home if you're sick and things like that. There are, subtle public health behaviors that can be conveyed through regular entertainment programs that can be useful. And then social media platforms, obviously, we've talked about quite a bit in regard to their influence on things. So this talks about, this case study talks about the role that nurses had in creating a task force to counteract disinformation that was being spread in an Orthodox Jewish community about vaccination. So it notes that Marcus and his fellow nurses organized the vaccine task force of Orthodox Jewish nurses to challenge false information targeted at Orthodox Jewish families and address the unique concerns of patients and families in their community. They organized small group sessions for Orthodox women during which they would discredit common anti-vax misconceptions and claims from the PEACH handbook, and that's the acronym for an anti-vaccine group. And they use scientific literature and research studies that have been translated into more approachable terms for the audience. So there again, I was talking earlier about the importance of appropriate terminology. So if you're using scientific literature and you're using research studies published or disseminated by scientists, there's likely to be a lot of jargon in there. So if you want people to respond to it who don't have a significant scientific background, you've got to make sure that you translate it appropriately. The nurses dissected the false information in the anti-vaccination handbook to best understand the beliefs that were circulating and created their own handbook that they called Parents Informed and Educated, or PIE. And they put a rotting peach on the cover to sort of poke fun at the group with the acronym PEACH. So another nursing group organized a confidential hotline where community members could ask questions about measles and the vaccine and request discreet at-home vaccination. So you see a lot of elements in there that we've talked about being put into action, especially there at the end, the vaccine hotline to answer questions about the measles virus and about getting the vaccination. The idea of providing discreet at-home vaccination. So some people might not be comfortable with going to a hospital or going to a public health clinic to get vaccinated because they may be afraid that they're going to be seen doing so and going to be ostracized by their community. So, having somebody come to a home discreetly and deliver the vaccination that way could help people to feel more comfortable and avoid that potential for social stigma there. So, and again, the idea of translating good scientific information, because you want people working off of the best available data, but the best available data, when it initially comes out, is not in a format that a lot of people understand. So that's an important element there. And just, the fact that, these at least, a number of these nurses were themselves Jewish, Orthodox Jewish. So it was people who were in that community talking to people who were also in that community. So it's been found to be more effective with these sorts of campaigns if you involve people that there's already kind of this relationship, or there's already this kind of inherent connection that people feel that the people delivering the message are more credible. again, the idea of tracking rumors that are circulating on websites, on social media. If you're tracking the rumors, then public health responders can proactively address them. They can identify public posts on social media platforms, reports from clinical care and community health workers and volunteers, and notices from community members when there are misinformation reporting mechanisms. So watching social media, if there's people who are actually working with the public who are hearing these rumors, gathering that information, if the public says that, they've been hearing rumors, in this case, they're talking about, or, the case study they provide next is about the Zika virus and, misinformation and conspiracy theories surrounding that. But obviously there were a lot of conspiracy theories surrounding COVID-19 and a lot of misinformation and disinformation about that virus. There's already some, misinformation and disinformation about avian influenza, even though it hasn't become the sort of high level concern that COVID-19 and even Zika did back in their time. But you want to be actively looking for this misinformation that could be making people skeptical of public health authorities, or could be making people skeptical of public health measures. An organization that has been really good at doing this sort of proactive monitoring of social media is the New York City Health Department. There's somebody that I follow on social media from the New York City Health Department called Tamer Hadi, and he's published a number of papers and delivered reports at different conferences about how to do good social media monitoring and how to prepare sort of counter arguments to the conspiracy theories that you expect to see. So, being proactive at addressing some of these rumors that are going to be coming out. So in regard to this, case study about Zika and misinformation, false and unsupported information shared on social media touted the true origin or agent behind the outbreak, the Zika outbreak, and cures for disease. People said it wasn't Zika that was causing birth defects. They argued it was pesticides or genetically modified mosquitoes. Other conspiracies cited international companies, people using it as a bioweapon. So researchers studied the rumor and conspiracy propaganda surrounding Zika, and they found that the rumors were shared 3 times more often than verified stories, because, part of it is the rumors and conspiracy theories tend to be more exciting than the truth. An international company using genetically modified mosquitoes to spread a bioweapon, it sounds like something from a movie or a television show, rather than just saying that this is a mosquito-borne virus that's actually been around for a long time and just, for whatever reason, in 2016 became a lot more prevalent in South America and in North America. So misinformation posts often contain words like hoax and false flag, invoked authorities to back their unsubstantiated claims, or were phrased as clearly leading and or rhetorical questions. These are recognized characteristics of conspiracy theory patterns, framed as just asking questions and using leading questions to undermine rival explanations without opening oneself up to criticism by providing an alternative. So, some characteristics to look for, if somebody's claiming, that and so I think some people have been making this claim on social media already. I'm pretty sure I've seen it on Facebook, where people have argued that the avian influenza cases around the country have been a false flag that the government is trying to ramp up for another false pandemic so that they can control the food supply or require people to get more vaccinations or what have you. So I've already seen some evidence of this out there in regard to avian influenza. And obviously the issues with, vaccination and controversy surrounding vaccination are more prevalent, I would say, than ever, considering that the current Secretary of Health and Human Services is somebody who has spent a long time expressing skepticism about vaccines. So now you have somebody sort of at the highest level of the federal public health system talking about, these kinds of sometimes misleading ideas about vaccination. So a University of Pennsylvania survey found that 35% of Americans believe that genetically modified mosquitoes were responsible for the spread of Zika. So, it shows that these conspiracy theories do travel and people are convinced by them. And once people get convinced by them, it's very difficult to kind of shake people from those beliefs. So that's why, again, it's important for authorities to do what they can early on to shape the narrative and avoid these kinds of conspiracy theories from taking hold in the public consciousness. So finally, the chapter wraps up by talking about, what is our role, even if we're not public health officials or doctors or anything like that, epidemiologists, we still, have important roles to play as citizens when it comes to communication. It talks about questioning. Questioning is the root of science. So it does say don't just rely on one source, try to get information from multiple channels, but at the same time, you do have to be careful about what channels you go to. And one of the things, that's been found to be so damaging with social media, like YouTube in particular, they found that if you start, go to YouTube and you search for information about avian influenza, you may come up with a variety of sources, but then if you watch one that is more kind of conspiratorial, then it's going to push you to keep going. It's going to keep presenting you with other conspiratorial videos. It's not going to continue to give you a sort of representative sample of all the different information. It's going to try to steer you down this one particular path of, conspiracy theories and misinformation and things like that. So it's important to look at multiple channels, but it's also important that we control that search and don't allow social media or AI or anything like that to control that search. Fact checking information, if you see something that seems kind of outlandish or seems too good to be true or something like that, you need to explore whether anybody has already fact checked it, and if not, try to seek out, are there other sources that are confirming this information? Are there sources that are contradicting this information? We need to do what we can to spread accurate information. One of the things, you can do on social media, if you see somebody posting something that's inaccurate, you can put your own post out there that actually provides the accurate information. Some people are more comfortable engaging on social media and getting into these sort of flame wars with people on social media. But at the very least, you can be a source of good, accurate information to counteract the other side. And then, acknowledging that things do change, as we talked about earlier. especially if it's a new pathogen or a pathogen that is evolving. So we have to acknowledge that in our own thinking, in our own messages that we're putting out, and acknowledge that, what we're saying today is accurate today, but tomorrow the recommendation could potentially change. So that's it for our discussion on Moore and cats, chapter 7 from the Outbreak Atlas, focused on communicating with the public. There's more to come in regard to the communication issues and risk communication. But until then, let me know if you have any questions, and I'll see you next time.